Good morning, everyone. My name is Mark Canavera. I'm the Associate Director of the CPC Learning Network. The CPC Learning Network convenes academics, policymakers, and practitioners to promote innovative research, to nurture communities of learning, and to build the next generation of researchers and advocates for children and families worldwide. Today, we are extremely excited to have some cutting-edge learning on the potential for interventions that are designed to reduce violence against women in households, primarily to reduce children's exposure to violence. And presenting that will be Dr. Nambusi Kyegombe, who has been working with organizations in Uganda and Makerere University in Uganda as well to study the effects of a very innovative intervention. We've had a lot of wonderful webinars recently, but I think you will all agree at the end of the hour or so that we'll spend together that this one has some extra special learning for us. Before I present Dr. Kyegombe, just a few notes. We will be moderating questions at the end of Dr. Kyegombe's presentation. So if you would like to send questions to her, free to do so in the questions box or in the chat box. We will receive both of those. So whichever one you're more comfortable using, you should see those on your GoToWebinar panel on your screen. And finally, we hope to have a respondent from one of the partner organizations that Dr. Kyegombe has been working with, Tina Musuyo, but she's having internet difficulties. So we'll know by the end of the presentation whether or not we will be able to hear that wonderful perspective, and we'll keep you posted. To introduce Dr. Kyegombe. Dr. Nambusi Kyegombe is a lecturer in global health and development at the London School of Hygiene and Tropical Medicine. She is an interdisciplinary social scientist with a development studies background. Her interest is in the bidirectional relationship between health and poverty, as well as other social and structural drivers of morbidity from a global health perspective. She holds a Master's of Science in Poverty Reduction and Development Management from the International Development Department of the University of Birmingham, as well as a Master's of Science in Demography and Health from the London School of Hygiene and Tropical Medicine. Her PhD research there examined the socioeconomic impact of highly active antiretroviral therapy on household livelihoods in Uganda. Before joining the London School of Hygiene and Tropical Medicine, she worked as a research officer at the Overseas Development Institute in London and currently works with the Gender Violence and Health Center, which is part of the Social and Mathematical Epidemiology Group in the Department of Global Health and Development. With no further ado, I will turn the microphone over to Dr. Nambusi Kyegombe to share with us some of her recent and very exciting and important learning. Over to you.
Wonderful. Thank you. Thank you very much, Mark, for that wonderful introduction and also for the opportunity to share the results of our study. We're very grateful to the CPC for inviting me to do this webinar. And the presentation that I am going to do is on behalf of myself as well as colleagues at the Gender Violence and Health Center, as well as our partners in Uganda, that's Raising Voices and SEDEVIC, which is the Center for Domestic Violence Prevention, both Ugandan-based NGOs. So as Mark mentioned, during this hour or so, we'll be looking at the potential for interventions that are designed to reduce violence against women, to reduce children's exposure to violence. And as Mark correctly pointed out, this is focusing mainly at the household level. So in terms of my slides aren't moving along. I don't know if you can see them moving along.
Let's see. Not yet. We still see the title slide.
Yes, me too. But, there we go. Great. Has it moved along now?
Yes, it has.
Okay, apologies about that. And just in terms of an outline, I'll start just with a little bit of the context. As you can see from this photograph, this is a typical community in which the study was conducted. As you may be able to tell, they are high-density, low-income communities. The gentleman there is collecting water. There's very little infrastructure, and households are very closely packed together. Livelihoods are insecure, and poverty is an important feature of the setting. This is in Kampala in Uganda. And what I'll also be discussing in the next few minutes is an introduction to what SASA is as an intervention, and then very briefly going over what the impact of SASA was before looking at how SASA is affecting children. So SASA, as you can see from the picture, is an activist kit. It was developed by Raising Voices, and in Kampala it was implemented by the Centre for Domestic Violence Prevention. And it's a community mobilization approach which takes a whole community approach, and SASA has been used in over 50 organizations in over 15 countries in the East and South and Horn of Africa, as well as there's been an adaptation in Haiti, as well as SASA Fate. So essentially what I'm trying to suggest is that though it's in a toolkit, it's very flexible and can be adapted to a particular context. In fact, that's where the strength is. It is adaptable to different contexts. It's a 4-phase intervention, and as you see, that's SASA, SASA. And SASA in Kiswahili, which is a language that's used in the East African region, means now, which essentially emphasizes the urgency of acting now to prevent violence against women. So in terms of those four phases, the first is the start phase. And in this phase, the implementing organization, in our case, SEDAVIP, takes time to actively learn about the community, figuring out the physical and social structures, power bases, where people congregate, social activities, and so on. And also, it takes time to select community activists who are normal individuals, men and women in the community who have decided or who have been supported to act within their community. And this first phase is very much about supporting the activists to foster the power within themselves and the activists to think about what they as individuals can do to address violence against women. In the second phase, it's the awareness phase, and this is very much about helping activists gain confidence. They're encouraged to conduct informal activities with friends, with relatives, with their church group, with their mosque, people in their local area. And in this awareness phase, the process is about encouraging critical thinking about men's power over women. Essentially, SASA and SEDAVIP don't use the language of gender or women's rights because that can be quite, can create a barrier. So power is, they found to be a very productive way of having these conversations because everyone has an instance that they can reflect upon where they have felt empowered or disempowered. So it's a less confrontational way of talking about how men's power over women can manifest in various ways. The next phase, the support phase, is about strengthening skills and connections between community members. This is very much about joining power with others to support change. So it's about supporting people to try out new behaviours and see how it goes. And then in the action phase, these new behaviours are emphasised as well as celebrating change. And it's very much about fostering the power to make positive change within the community. And across these phases, the program involves community members, leaders, and institutions, the purpose of which is to build a critical mass. So a whole load of individuals joining together to make a huge a critical mass within the community to make change at the community level. So essentially, it's not just about individual change, it's about change across the whole community. And SASA uses multiple strategies. Local activism is those activities that community members and community activists conduct in their community. Media and advocacy, these are some of the examples of communication materials that SASA incorporates. And training is conducted by the implementing organisation to support activists and also to support staff within the implementing organisation to ensure that they are supported to conduct the activities, and the content evolves with each phase. So obviously at the beginning and at the end there is an evolution in the material that is being used. So we were approached as the London School of Hygiene and Tropical Medicine to find out if SASA worked. Raising Voices and SEDAVIP had for years very strong anecdotal evidence to suggest that SASA was working, but they needed hard evidence, so to speak. And so we set up a partnership in which we had 4 evaluation components. The first was a cluster randomized controlled trial. The baseline was conducted in 2008 and the follow-up in 2012. We had qualitative research, both at baseline and follow-up. And then throughout the whole process, we conducted operational research and a costing study as well. So just in terms of the background, I'm sure this won't be new to a lot of people who are present today, but the prevention of intimate partner violence and violence against children, and in this case I'm taking the example of child maltreatment. As we know, there are several different ways in which children may experience violence, and there's actually growing evidence that intimate partner violence and child maltreatment often co-occur in the same households. And this, to an extent, is because they have similar normative and structural drivers. So in contexts, for example, where men are the head of the household, men should not be questioned, where men are considered to have the right to discipline for infractions of expected behaviour. They may discipline their wife or they may discipline their children using violence. And similarly, in contexts where violence is considered as an appropriate way to address behavioural change, mothers may also use violence to discipline their children. And much of the current evidence on violence, more specifically IPV, that it is preventable, assesses the impact among direct recipients of intervention programs or their partners. So households or couples or individuals who use or experience violence are supported and the intervention is at that level. But SASA, as I mentioned, seeks to prevent violence by changing the social norms that actually perpetuate violence against women at the community level. And so the question then, how then should we approach prevention of child maltreatment? Should we look at it in terms of improving parenting? Should we look at the violence that children experience in school? Should we try to strengthen the justice system? Should we look at intimate partner violence? I would obviously argue that we should look at all of that, but what I'm outlining here is just around IPV and not the other aspects of violence that may also be very important to reduce child maltreatment. So just as a very quick whistle-stop tour of some interventions that have sought to reduce violence in the home or in the family, many interventions seek to improve the reduction of harsh punishment and improve parenting practices. One example is the Synergies Caring Families Project in South Africa. Again, in Africa, the parenting for good behaviour and respectability and parents make a difference, and parents as part of good health in Uganda. All of these programs are trying to improve the way in which children are disciplined in order to reduce harsh physical punishment. Other groups of interventions, whether explicitly or not, seek to reduce children's exposure to intimate partner violence and other family-based violence. An example is the Serenity Harm Reduction in Zambia, and then SASA, so again, reducing children's exposure to intimate partner violence. But it's important not to think of these as mutually exclusive, owing to important intersections between violence against women and violence against children, and the potential for an integrated approach. Parents Make the Difference, for example, in Liberia, was, like SASA, an intervention that sought to reduce IPV, but was shown to have impacts on child maltreatment as well. So it's not necessarily helpful to think of them as either violence against children or IPV, because some intersections mean that both can be addressed at the same time, or at least there is potential for that to be true. So what are these intersections between violence against women and children? As I mentioned earlier, often there are shared risk factors and normative drivers. Risk factors include, for example, poverty, alcohol misuse, poor communication. Normative drivers, as I mentioned, views of gender roles and hierarchies of power within households. There is often the co-occurrence, as I touched on earlier, within the same household, and intergenerational effects. So children who experience violence in childhood may be more, it may be associated with increased violence experience in adulthood, and similarly, women who experience violence may be more likely to experience violence in their childhood. And there are similar consequences, physical, emotional, and to people's well-being as well. And violence against women starts early. If we think about different forms of violence at the very early, infanticide, child marriage, girl children not being offered education in the same way as boy children, and so on. So violence against women starts as women or females are girls. And another important normative consideration is violence or issues that relate to violence are often seen as private family issues in many contexts. So though you might not appreciate or you might not like what you see going on in your neighbour's house, you don't involve yourself because it's a private family issue and therefore not something that should be interfered with, or at least that's the perception in some contexts. So what did the SASA intervention show? This is the broad overall findings. I'll go a little bit into the specific findings about children in a second. But the findings from the study showed that SASA impacted on a number of primary outcomes. And this paper is available. It's open access, so it's freely available. And what we also found is a paper around the mechanisms, the pathways through which SASA worked. All of these papers, as I say, are available online in open access format. An important other finding was related to SASA's impact on reducing HIV-related risk behaviours and improved relationship dynamics. So in terms of the impact of children's exposure to violence, these findings that I will be presenting in a second are available again in this paper, which is open access. So before going into those findings and to look at how SASA is affecting children, there are a few things I need to point out. First, SASA was not specifically designed to focus on children. None of the activities specifically talked about children. There may have been activities that ask people to consider how do you think violence is affecting your family or your household, but nothing specifically focused on children. And similarly, the trial did not explicitly assess whether the intervention impacted on children's experience of violence. So there were questions, for example, around who might have witnessed any violence that occurred, or whether people had talked to their children about violence, but we didn't have any primary or secondary outcomes that were specifically measuring violence in or children's experience of violence. So the findings that I will present emerged as part of the qualitative analysis as well as secondary analysis of trial data. And the quantitative findings that I'll present are among partnered women with children or stepchildren in the home. And for the qualitative finding, these are amongst couples that experience reduction in violence in the past 12 months. For safety and ethical reasons, we didn't sample any households in which violence was continuing as part of the qualitative evaluation. So what was the impact of SASA on exposure to and or witnessing of violence? We found that at follow-up, women in intervention communities were less likely to report past year experiences of physical or sexual violence than their control counterparts. And importantly, among those that reported past year IPV, intimate partner violence, fewer reported that a child was present or overheard instances of violence when it did occur. And we estimate that reductions in IPV combined with reduced witnessing led to a 64% reduction in the prevalence of children witnessing IPV in their households. And this is obviously very important. If this impact is sustained through time, that has important implications on the intergenerational transmission of violence. So, for example, if as an adult you reflect on how your parents resolved conflict and you remember that they resolved it through using violence, that may become a learned behaviour and a way in which you resolve conflict with your intimate partner when you're in the future. So if children are less aware and less exposed to witnessing violence, that could be a very important way of breaking the cycle of violence. But importantly, another impact that was very clearly coming out was that there was reduced family disruption. Women in the intervention communities were 49% less likely to have stayed away from home for at least one night in the past year due to IPV. One female in one of the intervention community described it thus: "My children are now free. They are living with their mother. Because if it was not for SASA, I would have moved on. I would have gone away." And this is very much part of the social context. Men typically children typically are seen to belong to men. So if a relationship breaks down, women don't often have the power or the means, particularly if they don't have an independent source of income or family support. They don't necessarily have the means to be able to look after their children. And there's a strong narrative around stepmothers, and stepmothers being key perpetrators of violence against their stepchildren. So the fact that this woman was remaining in her house was also seen as a way in which her children in the future were less likely to experience violence because her household had been maintained. There was also some impact on parenting. Again, this wasn't part of the programming or part of the evaluation, but SASA seemed to improve the quality of some parent-children relationships by encouraging communication and connectedness, for example, particularly with young children through play. One male community member describes it as, before I joined SASA, my children were afraid of me. My children would never hold a conversation with me, but from the time I joined SASA, I converse with them. They are free with me. They even tell me their problems. They even correct me when they feel I'm not right. When I'm not right. They no longer fear me. They tell me their problems, and I also tell them why I'm not able to give them what they need. Before, they used to think that I deliberately refused to meet their needs. Now, this quote captures a lot of important aspects of the changes that SASA inculcated. One, around communication, both with children and with intimate partners. For a man to communicate why he wasn't able to meet a child's need was an important step, not only for the children to recognise that it wasn't as a means of withholding resources that he otherwise might have had, but also for them to understand the struggles that he had gone through. And also for a child to be able to tell an adult and a man that they haven't done something right really does capture something about the shift in the relationship. So where a man isn't questionable, for a child to be able to tell them when they've done something wrong suggests very much that their relationship had improved and the safety in which the child felt they could speak to their parent, was clearly coming through. There's also some evidence to suggest that parents were reflecting upon how their words impacted their children. One woman who was a community activist described how I would him, referring to her son, calling him stupid, not knowing that whenever you abuse a child and call them stupid, he goes to class thinking that mommy also told me that I'm stupid, so he attends class thinking he's stupid, which obviously would have affected the child's potential to perform at school, but very much thinking about how, the whole saying, sticks and stones may break my bones, but words will never hurt me, for them to really think about how their relationship with their child was affecting their child's self-esteem and evaluation of themselves. And then in terms of parenting, amongst older children, SASA seems to also be encouraging some parents to involve their children in household decision-making, although often with relation to decisions that directly affect them. So asking their children explicitly, where do you want to go to school? Why do you want the school? What's wrong with that school? But very much now enabling children to have an opinion and acting or considering that opinion in a serious sense before making a decision. There was also some suggestion that SASA affected how parents disciplined their children. And one thing to note is that corporal punishment is not normatively seen as violence. So you could ask a parent, do you think violence against children is wrong? And they'd say yes. But then you'd say, do you think beating is wrong? And they would say no, because they don't necessarily see beating as violence. But in a few cases, because of SASA and rejection of violence, parents no longer use corporal punishment to discipline their children. One female community member describes, according to what my children have gone through and how their father would beat them before we separated, I cannot punish my children. I treat them carefully so that they can heal from the trauma they have experienced. I do not want them to say that I also mistreat them after going through a lot. I want to defend my children. Before SASA, I would beat them. So having reflected on her use of violence herself, this mother made the decision to reject all forms of corporal punishment against her children. But some parents still continue to use corporal punishment, but the context and the way in which they used it was changing. One father describes, before I joined SASA, whenever a child made a mistake, I would, without understanding, punish the child badly. But from when I joined SASA, whenever a child makes a mistake, I have to first understand the cause of the mistake, and I even take time to talk to the child. When he repeats the mistake, that is when I carry out the punishment. But the child has to understand I first talk to him before punishing him. So, granted, yes, the use of corporal punishment or the continued use of corporal punishment isn't ideal or isn't acceptable, but the fact that he was recognizing that corporal punishment wasn't the first resort and shouldn't be the first resort was important, because in theory that child had an opportunity to understand what they had done wrong and, in the father's eyes, avoid the physical punishment that could have ensued. And importantly, SASA also provided some parents with alternatives to corporal punishment. We have been taught how we can discipline our children, but not to beat them, because even me, I do not like it when my husband beats me. What about the children? So some parents described how they felt it very important. And again, all parents around the world, I think, would agree it's important to discipline children. But some parents described how they weren't aware of other non-violent ways to discipline their children. So the reflections and support that they had through SASA meant they now had ideas. For example, talked about withholding treats from a child who misbehaved, or making a child who misbehaved conduct a disproportionate amount of chores that day, as a way of ensuring that discipline maintained, which obviously was very important, but without using violence in order to meet those ends. The third way in which SASA seemed to impact was around activism. As I mentioned, SASA is a community mobilization intervention which requires that the community mobilizes against violence. At the community level, individuals were less tolerant of violence against children, and here it was very much harsh physical punishment because, as I mentioned earlier, violence wasn't always seen as normatively, beating wasn't always normatively seen as violence, but anything that was considered excessive or harsh, people were much more willing to intervene. And they thought this was important, not just for the child's welfare, but also for the community, because children who came from violent households were considered to be those who roamed the street, who were street children, or those who were involved in crime. So people's willingness to intervene was not only for the welfare of the child, but also broadly for the welfare or the perceived welfare of the community. And people were more willing to intervene or report the violence to activists. LCs are local council chairpersons, which is the lowest level of government, or the police. So this is a gentleman who talked about the sessions have helped. You find that in slum areas like this, many people make mistakes at home, and they do them unknowingly. So for us who have been to those sessions, we are like attorneys for such children, or we are like watchmen for abused people in the community. On many occasions, I have confronted parents and rebuked their actions. So this man describes the shift that he had experienced. Not only did he now better understand the consequences of violence and what was wrong with violence, but he felt he had a personal responsibility, to act to prevent violence. So he was willing, for example, to confront parents and rebuke their actions. And this was important because people now had a sense, or people described knowing what to do. And not only knowing what to do and believing that something could actually be done, because prior to SASA, intervening meant greater personal cost. So if, for example, your neighbour's child was being treated in a way that you didn't like, whilst you might not have liked it, you might not have known really what to do about it. And if you were willing to act, it might have meant that you had to take that child into your household, and that had implications on how you would feed them and how you look after them if the intervention didn't result in change. So if, for example, you went to the police and the police didn't really respond appropriately and the violence continued, were you willing to take that child in, at least in the short term, to remove them from the situation of violence? But SASA was also perceived to be a way of finding a lasting solution for stabilizing the home and thus improving the lives of children. So it was very much moving from helping children in the event of specific acts of violence to improving the family and improving their family situation such that they wouldn't then need to intervene in the future because the household had been and the couple had been stabilized. So what does this now tell us about how interventions to prevent violence against women and child maltreatment may interact? What are those common prevention opportunities? What we learned from SASA was that engagement and reflection on violence and its consequences has a lot of potential. So once you have taken time to think about what violence is and what the consequences of violence are, whether it's violence against women or violence against children, that reflection gave people the opportunity to think about how appropriate or how acceptable violence was, irrespective of who it was meted against. Another important common prevention opportunity is to support people to question power and good and bad uses of power. As I mentioned, at the center of SASA programming is power, the language of power, because people have instances where they felt empowered and disempowered. So if you think about how you can use your power for good and how you can use your power for bad, then regardless of whom you're using the power against, it's a way in which people are able to reflect on how they could behave differently. Another important common prevention opportunity is around communication and joint decision-making. The father that we saw earlier learned how, through communicating with his children, he was able to improve the relationship with the child, children. And joint decision making, granted children are young, so therefore perhaps the opportunities for joint decision making are somewhat context specific or somewhat limited. But again, communication and joint decision making, whether against or whether to improve a relationship with a fellow adult or with a child, hold important potential. SASA also provided space to develop intimacy, connectedness, and cooperation, both between intimate partners and children. So where adults talked about taking the time out to play with their children, this obviously provided an opportunity for them to develop their relationships in the context where livelihoods are insecure, people, for example, are living on day labor. For an adult or for a parent to take time out of earning money in order to talk to or play with their child was actually quite a significant step, because the time that they could have been looking for money, as it was known, they were taking time to play. And that actually resulted or presented a constraint, particularly to fathers who were more concerned to were often concerned to making sure that their children were fed, that they had school fees and clothes and so on. And they felt the time playing with them, whilst they would have liked to, they didn't really have that opportunity. But there is also a common opportunity, a prevention opportunity in awakening activism and a sense of responsibility to act. So once you've accepted that violence is wrong and violence isn't acceptable, you can, through such approaches, awaken within people the commitment to actually do something when you realize that violence is wrong. But this is actually premised on knowing what to do. So having the skills, for example, for non-violent conflict resolution, and also better community-based structures and response. So when you know that there is a structure or an individual or an institution within your community that will respond appropriately to your activism or your efforts to address violence in your community, then you have much more confidence in continuing to act to prevent violence than if you, for example, go to the police and the police say, oh, that's just a domestic issue, that's nothing to do with us, and therefore don't refuse to act. That said, though there are common prevention opportunities, what are the risks of a combined agenda? And essentially not everything needs to be integrated, and there may be costs. If, for example, you have a Centre for Violence Against Women and Children, will children's voices be heard appropriately? Or because they are considered minors and adults are expected to make decisions on their behalf, will their voices be muted by the fact that they are being banded together with women? And similarly, will services be adequately tailored to the needs of children or adolescents? Just think, for example, about reproduction and sexual health services. If a child is going to the same services as an adult, what does that therefore mean? Or an adolescent is going to the same services. Will that service or will the service providers be sufficiently sensitive to the particular vulnerabilities of a sexually active adolescent, given that in a lot of contexts, adolescents aren't expected to be sexually active? But similarly, will children's rights take precedence over women's safety, or will women be penalised when children are exposed to intimate partner violence? The whole idea of when he was being violent towards you, why didn't you just leave? You put your child at risk, and therefore there should be consequences for you around child neglect or exposing your child to a violent or a difficult situation. And so, as such, will women's needs be overlooked? If it's in the best interest of the child, what does that therefore mean for what the best interests of the woman are? And what about the intersections with other forms of violence? So, for example, youth violence or community violence. To what extent is a combined agenda appropriate, or should the different forms of violence be addressed separately? So those are perhaps more questions for discussion than answers as such. But essentially, there are opportunities to combine or to address common prevention opportunities, but we must be aware that not all of those are necessarily ideal. Thank you very much.
Thank you so much, Nambusi. That was an extremely rich 30 minutes, and I'm sure that everyone who has been participating so far has learned a lot, even those of us who've worked in this sector for a long time. I do want to remind all of the participants that this is a great moment as we move into the response here to send us questions via the chat box or the question box, and we will get both of those and get those to Dr. Kyegombe. Before I introduce our respondent, I wanted to give a few reactions myself because I really just thought that was a wonderful presentation. Um, I thought that the introductory piece that you did on the interconnections between violence against women and violence against children was truly masterful, like a master class in how to conceptualize the interlinkages of these. And I would recommend for people who want to learn more about this to revisit when this recording is posted, those slides, to look at how you set that up. I also think that the intervention itself and its focus on social norms change, the SASA intervention and the comprehensiveness of it, working not only directly with families but at the community level, is really a nice model. And I think that as we think about this structurally and systemically, we'll have a lot to learn from the intervention design itself. And finally, on the findings and on the research itself, I mean, this is one of the most beautiful uses of mixed methods that I've seen. So thank you for integrating both the quantitative results and your qualitative research so beautifully, and for helping us to understand how they speak to one another. The pieces that struck out to me in the results were, first of all, the 64% reduction in the prevalence of children witnessing violence. I mean, it's a major figure, and when we think about it, not just in terms of figures, but in terms of the impact that that has on the homes that children are growing up in, that is such a promising finding and so encouraging. I loved all of the quotes that you brought forth and the examples on the changes in parental communication. And they really helped richly illustrate exactly what's happening with the changes in family dynamics that this program is prompting. And the last point that I wanted to make was that we often think about community-based approaches or community-driven approaches as improving the effectiveness of the intervention, but something that I really appreciated that you pointed out so well is that the relationship between communities and interventions is bidirectional, and it goes both ways. And thank you for pointing out how the intervention itself interacted with and impacted upon the way that activism was being undertaken at community level, so that we do not think of communities as mechanisms for service delivery, but as changing entities that themselves, the dynamics of communities change as interventions take place. I mean, thank you so much. We have several questions coming in, but I do want to also give a few minutes to one of our senior research associates, Khadija Asghar. Unfortunately, Tina Musuya, who's the executive director of SETAVIP, the organization that was working on this intervention, one of the partners working with Dr. Kyegombe, is having internet difficulties, and you may have seen her popping in and out of the presenters list, but unfortunately she's not currently connected. But we do have a respondent who is quite involved with similar efforts, and we just wanted to ask for a few thoughts from her as well. Khadija Asghar is a senior research associate with us at the CPC Learning Network, who holds a master's in public health from Columbia University. Her interests are in violence, perceived as a disease that spreads, and her research experience with vulnerable youth and national and global contexts is quite extensive. Currently, two that I will point out are the Transforming Households, Reducing Incidents of Violence in Emergencies, or the THRIVE project, which we are undertaking in collaboration with UNICEF. This examines drivers of violence at the household level, the linkages between violence against women and violence against children, as you so masterfully pointed out, and specifically in emergency contexts. Khadija also supports an adolescent girls program evaluation with the International Rescue Committee in 3 countries, the Democratic Republic of Congo, Ethiopia, and Pakistan. building capacity and developing tools in preparation for a randomized control trial that's actually underway evaluating a life skills and violence reduction program for adolescent girls. Khadija, over to you for a few thoughts, and then we will collate these questions and get them to Nambusi.
Thanks, Mark, and thank you so much, Nambusi. That was an excellent presentation. Reflecting on it and what you've been saying, looking at SASA as a multi-tiered intervention, it's very clear that it addresses the idea that violence happens at different levels and that there are different efforts needed at these different levels. Expanding upon that as well, you mentioned that programming for SASA, for example, was only targeting IPV explicitly. And we often see this in the field, that programming targets either gender-based violence or intimate partner violence, or it targets violence against children. And the result of efforts recently, and efforts such as this paper, to really look at the ways in which these two things intersect, we believe is going to be an increased attention towards looking at both of these outcomes explicitly and looking at especially the household level, which we know has been neglected in the last few years and in, unfortunately, the history of programming, but thinking really intensely and thoughtfully about how, when we create a program, we target, or we identify who is going to be the primary target of that, and then how we consider as well the more systemic or unintended effects. So in this case, with this paper, looking at a program that was targeting IPV, but whether it did have effects beyond that and effects towards violence against children. One of the things that I thought was incredibly interesting about this was an expanded understanding of ways that intimate partner violence can affect children. One being explicitly, one of the outcomes was looking at the time women spend away from the home or outside of the home. And that's not something that we often discuss within the field explicitly, but is an important, can be an important determinant of health of children, is whether or not the mother is present in the home and how frequently the mother has to leave and whether the children are able to go with her or stay. And so with that, I wanted to give you a huge congratulations on this paper, and I think turn it back to Mark.
Thank you, Khadija. The questions are absolutely streaming in, so I'm going to get the first 4 to you. The first, some of these are about the intervention itself, and others are about the results. From Janine Carmichael, the question is, did SASA have an explicit parenting module, or were parents extrapolating alternative discipline from the adult-focused techniques in the intervention? Another question about the intervention is that you had mentioned not using the word power in these communities given its negative connotations. With that in mind, how did the program engage men and boys to promote behavioral change? That was a question from Amy Nuguruki. 2 questions that are linked to the outcomes. Michael Gibbons has asked, is there any evidence of knock-on effects of better relationship and care with children concerning parents' confidence, stress relief, and self-image? A second question from Michael is, could you tell us a little bit more on the role that SASA has played as enabling conditions in the community to support local activism and to support the agency of parents and children? And then a final question, these are 2 that go together. What is the sustainability for such an intervention? What is the role of the government or the national social system in implementing SASA? That is a question from Zara Mirgani, and apologies for mispronounced names. Please feel free to come back to me, Nambusi, if you'd like clarifications on these questions. Otherwise, I'll turn it over to you.
Great. And thank you very much, Khadija, also for your reflections on the paper and the findings. And to everyone who's presented questions, I hope I'm able to do justice to them. And my apologies, I didn't catch everybody's name, but the first question was around parenting. And no, the intervention didn't have a specific parenting module. It was, as the questioner suggested around extrapolation from the reflections and the support that people had to consider intimate relationships. So, for example, in all 4 phases of the intervention, there would be activities, or, for example, a community conversation. There would be the activist would hold up a poster, for example. Let me see if I can flip back actually to the materials as I speak. So they would hold up a poster and ask the community as a group to discuss what they were seeing and what it meant. So if, for example, the group was supported to see where it says become aware, that would be used as part of a community conversation. The activists would use these materials to structure conversation. So if the session was around communication, people would be asked to consider what good communication means, what bad communication means, what are the opportunities, what are the threats of not communicating well, issues around misunderstanding, issues around distrust, and so on and so forth. So once they'd had that reflection with their intimate partner, it wasn't such a leap to then think about what that could mean for better communication with a child. So for that man, he didn't have money to give the child whatever they wanted or needed. And prior to SASA and prior to this reflection on, for example, communication, might have just said, I don't have it, or go away, or given a quick slap to end the conversation. But having been supported to reflect on what it means to communicate the challenges, or to communicate so that the other person can understand where you're coming from, he talked about having followed, after SASA, he was more willing and able to communicate his challenges to his child. So that's a way in which what was learned through the activities was extrapolated to children rather than a specific program on parenting. And similarly for discipline, if you now recognize that hurting someone physically or emotionally is not a good thing, why then would you hurt your child when you wouldn't hurt your intimate partner? Children and corporal punishment is still normatively seen as a responsible part of parenting in some contexts, for some people. So the switch to no longer using corporal punishment on a child, a lot of people quoted the biblical verse, spare the rod, spoil the child. So it almost saw it as a responsibility to shape the child, and a lot of people only knew of corporal punishment in conjunction with counselling and guidance as a way to make sure a child was brought up well. The second question was around, I think, Mark, you said the intervention didn't use the word power. Unless I misspoke, the intervention didn't use the word gender, which was seen to potentially cause a barrier. It was power that was used, very much the whole idea being that when you are empowered or when you are disempowered, along with that comes certain feelings. So, for example, for a man who has felt disempowered by, for example, a boss or a client or a friend or whatever, that feeling of feeling little or feeling small or feeling concerned or worried or whatever negative connotations come with feeling disempowered was used as a way for men to also understand and reflect on their use of power. And similarly, women have examples of when they've used power in a good way and when they've used power in a bad way. And that relates to the question on how men and boys were engaged. Children weren't part of the activities as such, though children may have been present during activities, particularly younger children who were accompanying their mothers. By using the language of power, there was a way in which men could be engaged in a non-confrontational way. Historically, once you use the word gender or women's rights, that can be interpreted or has been interpreted about putting women up and bringing men down, and therefore it was the experience was often that resulted in conversations coming off track. But given that these are community activities, the programming and the activists made specific effort to find men where they are. So if, for example, there's an activity being done in or around the home, men during the day are typically at work. So the activists would go to the workplace. So they would, for example, conduct activities at mechanics workshops or what are known as boda stages. A lot of transport in Kampala is on motorcycle taxis. And these are organized around stages like bus stops. These are motorcycle stages. So you'll find a lot of men sat at a particular location waiting for a client to take wherever they need to go. So the activists would go to them and find them where they were to ensure that men were also had an opportunity to attend activities or at least be exposed to material. There was a question there about knock-on effects around relationship and care and image and self-image. I must confess, I've forgotten how it was brought up, but it was there was a sense that through participating in SASA, people had this opportunity to change. And in fact, at the beginning, there was a process through which women had to also understand why their husbands were changing, because suddenly, if he was no longer, for example, using violence, or their relationship dynamic had changed, there needed to be a process where people were supported to understand what was going on and why the change was happening. So there was a sense that people wanted to be better. One thing that came out in the Pathways paper that I briefly showed earlier is that men very much appreciated the space to be able to say, for example, I went to work all day today, and because of various challenges, I haven't been able to bring back enough money for our dinner tonight. Now, prior to that safe space being available, the woman would, for example, have assumed that maybe he was gambling or drinking, or he had a girlfriend, or he had another family. So in terms of image and self-image, being able to communicate and to describe the challenges that they felt, some men experienced that as a positive thing because it enabled them to take control of challenges that were beyond their ability to change. I must apologize, I probably haven't answered that question well, so please do restate it if I haven't done. And then there was also a question around sustainability and the role of the government. SASA, this trial was conducted in the intervention. Following the intervention, we are now, or instead of raising voices, are implementing it in the control communities. And what's an important resource there is the activists who are part of the intervention communities are supporting those from the control communities. And one activist very powerfully said, because we were asking around how do you think things will be now after Sediment no longer provides ongoing support, and she said, if we stop now, it's like washing your clothes and drying them in the sand. So for her, the fact that they had got to where they were as activists, and they were just normal community members, but because they had gone through an internal personal transformation and believed so deeply in what they were doing, all of these activists were unpaid volunteers. She very much thought that that was now her identity. And this particular activist didn't have a lot of education, never had a position of responsibility, never had a position of respect in the community. But being known as an activist who could help families and keep them together and improve relationships became a vocation for her, and something that very much was something that she expected to continue going forward. All of that said, SASA is also now being implemented in the east of Uganda by the government of Uganda as a means of trying to understand what that might look like when it's not being implemented by an activist organisation, but instead is part of the responsibilities of community development officers. The 4 phases haven't been completed yet, but essentially work of Sediment and Raising Voices has been very much to engage the appropriate line ministries. So in this one, the Ministry of Gender, Labour and Social Development has been very much on board from the very beginning. So the Ministry of Gender, Labour and Social Development has taken on SASA and it has included it as part of the responsibilities in one district in Uganda to see what that may look like. But this has also come in concert with important legislation. So the Domestic Violence Act in Uganda, which protects all people in households, men, women, and children. There's also other legislation that protects against violence. So, for example, legislation around FGM, female genital mutilation, and so on. So, in terms of sustainability, it's a question that will always be there, but there are positive signs that not only is the government engaged in trying to address violence, both legislatively but also in a practical sense, and also suggestions that those people who have seen the power and the potential of activism can actually be supported to continue in the future.
Thank you, Nambusi. There are just a few more questions that have come through, and even if we go slightly over an hour, I hope that's okay with everyone because we're learning a lot here. A couple of more questions to clarify the intervention. Rose Wilder has asked two questions. One, is this a community-based or a home-based intervention or a combination of both? And also that it's recognized that the intervention focused on parents and adults, but what is the age range of the children for whom data were collected? I think you've already addressed to some degree Kalisa Godfrey's question, which is the following, but maybe if you have some final words there. Can you tell us about the alternatives to corporal punishment that emerged through the SASA intervention? Finally, this may be outside of the scope of this webinar, but we'll go ahead and put it out there. Jennifer Kang has mentioned that the co-authors include health economists. Has there been a look at the cost effectiveness or the efficiency of this intervention, especially as compared to the quote, standard of care or the mass communication style campaigns that are usually promoted as violence prevention?
Great. Thank you for another wonderful batch of questions there. In response to the first, the implementation of the intervention or SASA as an approach is community-based, but it has a range of activities. So as I mentioned, it could be a community conversation in which people congregate in large numbers to discuss a particular theme. It might be a community drama which attracts hundreds and is a very sort of the highlight of the day, a lot of drumming, a lot of attention drawn to it. Or it might be something as individual as a quick chat or a door-to-door conversation, particularly for some women who aren't able to leave home, either because of violence or because of household responsibilities. An activist could go to their door and conduct a one-on-one activity. So there's no formula of exactly what it needs to involve. And I should also have mentioned that the activities also engage, I don't know if you can see there in the top right-hand corner, a small thing that says health chat. So SASA was also engaging local services, so for example, police and healthcare workers, so that when we look at the whole community approach, it isn't just the people there, it's also the institutions, particularly around the police, where prior to the intervention, some people complain that there's no point going to the police. The man just pays them off with a little money and they lose the file or whatever. So it's very much also improving the response of services. But yes, it's both a community and a community in the broad sense, large numbers, but also community in the small individual level if necessary. In terms of the participants, yes, most of the participants were adults. I should have made clear that we didn't actually interview any children because we only had ethical clearance up from 18 and above. So none of the reports that I included were of children, and it was parental reporting of the experience of children in their households. In terms of alternatives to corporal punishment, ways in which parents talked about now using other opportunities was increased guidance and counselling and warning. So so corporal punishment wasn't necessarily eliminated, but it wasn't the first resort, and it was accompanied by warning. If you do that again, I will do this or I will do that. But also the counselling and the guidance, explaining what the child had done wrong. So taking the time to say, this is what you've done wrong, I don't like it, if you do it again, this will be the consequence. And then, as I mentioned earlier, withholding treats from a child who had misbehaved, or giving them a disproportionate burden or something that they didn't enjoy, like chores or something, were ways of ensuring that the behaviour changed without necessarily using violence, or without using violence as a first resort. And yes, absolutely, we did conduct the cost-benefit analysis. It was conducted by my colleague. Her name is Christine Michaels-Ibokwe. That paper has just been published. It's also open access, and she calculated the unit cost of SASA as part of DALYs and disability-adjusted life years. I can perhaps forward a link or something, but that paper is, the costing of SASA is now available as an open access document.
Great. Well, if you can send us that link, we will send it out with the recording to all of the participants today.
Great.
Any final thoughts from you, Dr. Kyegombe, or Khadija? No?
I don't know if, perhaps wait a bit long. I don't know if Khadija has any final thoughts, but this has really been a great opportunity for me to share these findings. And this is just part of what we are learning as a community and as a field. I'm not sure how familiar people are with the No Violence Initiative, no spelled K-N-O-W, but that's very much looking at children's experience of violence and this idea of intersectionality of violence against women and violence against children it was one of 4 key themes that No Violence will be exploring in 4 upcoming papers. So there'll be one whole paper on the intersections of violence against women and children. So it's something that definitely has the potential to become a very important contribution to reducing people's experience of violence. I know, for example, that Raising Voices are considering what prevention of family violence might look like. But again, there is some caution around making the issue violence against women and children as opposed to violence against women and violence against children as 2 important and yet distinct fields. An example of the threats of the joint or combined agenda is, for example, around maternal and child health issues related to prevention of mother-to-child transmission. A woman becomes worthy almost of antiretroviral access to antiretrovirals to the extent that she is there to prevent vertical transmission of the virus to the child. But then, until quite recently, the antiretrovirals were available during and after, just immediately after pregnancy, but then the woman as an individual was not necessarily able to access antiretrovirals once she was no longer pregnant or no longer nursing. So what does that therefore mean if a woman is seen as part of a child or a child is seen as part of a woman? So yes, there are opportunities for a combined agenda, but we just need to be careful about how we move forward on that.
I agree completely, and I've thought all of this has been excellent, but the slide that you had towards the end of the presentation highlighting some of the risks or the considerations that we need to take into account as we move forward in thinking of an integrated agenda were just excellent. As I recently heard one of our partners exclaim, for years children have been seen as an appendage to women, vice versa. It's women and children or children and women. And there are certainly some important ways in which we need to think about how reducing violence against both groups should be addressed, but we also need to be careful in doing so. Khadija, any final thoughts?
Hi. I think both of those points are really well taken. As we do move forward with looking at these 2 things together, I think that one of the interesting populations that Nambusi had brought up before as well is teenagers and adolescents and, for example, sexual activity and other things that people may or may not be doing and whether or not that's culturally acceptable. And so as we do consider these things together, we have a population of sort of in-betweens, and not quite a woman, but not a girl anymore in that vein. And so I think not losing sight as well of some of those areas of gray in which, we in the West may conceive of things a bit differently than the communities that are directly implementing this programming, and how we can really address some of those issues as well when we look at intimate partner violence and we look at violence against children.
Thank you, Khadija. Dr. Kyegombe, this was simply superb. I know that I speak on behalf of all of the attendees when I say thank you very much. This was extremely rich learning, very well thought through intervention, and the way that you are collectively with your team of researchers and your partners drawing as much learning as possible from this experience is very much appreciated. As Dr. Kyegombe mentioned, there will be some forthcoming studies from the No Violence Initiative. You can keep up to date with that at No Violence in Childhood. That's KNOW, violenceinchildhood.org. You can keep up with the CPC Learning Network at cpcnetwork.org, and we will send the materials, and if it's okay with Dr. Kyegombe, her contact information to all of you who have participated. We thank you all for your time this morning, evening, afternoon, and we look forward to joining you all again soon in some other format to continue the discussion and to continue learning. Thank you again, Nambusi. That was just excellent, and we are truly appreciative.
Thank you. Thank you very much indeed for the opportunity, and lovely to be acquainted with the CPC network.
Wonderful. Have a good morning, afternoon, evening, or night, wherever you are in the world. Bye-bye.
Thank you. Bye-bye.